Hello, welcome. Please, before we do anything, hit that subscribe button, give the video a like, and share it with your friend. Today, the topic is what can we do after a failed surgery. This is a illustrative case of a young man who presented with bilateral varicocele, causing pain, symptoms, and infertility, for which he had undergone a good, successful surgery. The problem, even if the surgery is successful, there were what we call a recurrence of these varicocele. So his varicocele just came back with a vengeance, causing him, similar issues, symptoms, persistent infertility. He was desperate to have babies, to have kids, and to start a family, and for that reason he was referred to interventional radiology. We discuss the techniques and the options with him, and I'll let you be the judge about the technique things. This is an ultrasound view of the right testicle, where we can see in the dark the dilated veins of the testicle, the pampiniform veins, measuring diameter of 4 millimeters, which is very dilated. And as we scroll through images, the left side, this is the left testicle on ultrasound, surrounded by very dilated varicocele veins. So you can see here almost the same size as the right side. And that can explain that the stagnation of blood will heat up the testicle, impairing the formation of normal sperm cells. Again, another view showing dilated veins, measuring up to almost 4 millimeters in diameter. Inside you can see the hyperechoic stagnating blood. So this young patient has bilateral varicocele. He had, prior to that, undergone surgery with the microscope that failed to help him, since his varicocele has came back again and recurred. So he was treated by interventional radiology, by coiling and placement of sclerosing agent. On the left side that we see here, these are the coils. So, and then he was referred to me because of the inability to find the right gonadal vein. The right spermatic vein, right gonadal vein, can be a little bit difficult to find, and some interventional radiologists may struggle with that. So I was able to find it and to catheterize it safely using regular technique. And I'm going to show you here. This is the right gonadal vein. You can see it's very dilated, with a reflux going all the way to the testicle. So again, I am showing this as an illustration of how surgery can fail, and how embolization is superior to surgery in that regard, because embolization can treat not only the main gonadal vein, but also those collateral veins that will develop over time and induce a recurrence. So I am here in the spermatic vein with my microcatheter at this level, right above the femoral head, so right about the hip joint. You can see that the vein was successfully blocked by the surgeon. You can even see some staples here. This is the area where the surgeon has put some ligation and some staples. However, the patient is still presenting with a problem, which is a very severe varicocele, inducing an infertility. So this patient could not conceive. He was getting desperate. He was mid-age. He was not that young, so he really wanted to have babies. So since the surgery failed and there was a recurrence, so we call that a recurrence, he was then referred for another option, which is an embolization. So after doing a microcatheterization of this vein, we wanted to determine what was the cause of this recurrence. So you can see here there are some veins that appear to be filling and going downward towards the testicle. So in an attempt to better characterize these veins, we decided to do a digital subtracted angiography to show us exactly the problem. So this is the digital subtracted angiographic run we do with our state-of-the-art machine. And I'm going to pause the image so we can discuss it a little bit. So this is the main vein where my catheter is. At this level here, this vein was surgically interrupted successfully. So the surgery at this point is great, is good. The surgeon did a good job by blocking the main spermatic vein. However, the surgery, the problem with surgery, they may leave behind those tiny little veins that will develop over time, and these veins will cause reflux. These veins will connect the testicle that is located here, and they develop over time, and they will go to join this diseased gonadal vein that already has reflux. So as a consequence, they will reflux too. Okay, so the blood will reflux from top to bottom, causing the varicocele to reappear. So how does embolization differ from surgery, and how, in my humble opinion, embolization is superior? Well, you can see that we do first a snapshot venogram that shows the whole network of veins from the top to the bottom. So we can see that there are collateral veins, there are some other branches that are normal here, there are other branches. So all these things the surgeon will have a hard time to find this, as he works only on an incision. The second superiority of embolization technique is we can take care of these collateral veins. So we're going to block everything. I'm going to show you the technique that we've done here. It is based on glue, which has the advantage of sealing off everything, the main vein as well as the collateral veins. And the other advantage is it doesn't leave anything behind. There is no coil, nothing left behind. And you can see actually where the glue distribute into the vein, as opposed to sclerotherapy, where it may not see where there's sclerosing agent because it's invisible on X-ray. So here I am just assessing a little bit the amount of glue that I'm going to inject, and one needs to know how to work with glue and how to do it fast and in a good fashion to avoid any complication. And that's it. I quickly deployed the glue. So this is what we call the glue cast. And you can see this is the glue again going all the way to the top part of the vein, and this will take care of everything. It will seal the whole vein, but not only the vein, but will prevent any collateral flow, any collateral vein to come and attach to this vein. So obviously we don't do a final venogram because we use glue. You know, the catheter itself is full of glue, so we can inject, but this in itself constitutes the final runoff that shows that the vein was successfully embolized, preventing any recanalization from collaterals. And this is again, in my opinion, the superiority of this technique. Not only it's less invasive than surgery, it does not involve any stitches or opening or scar or general anesthesia. It does not have the risk of injuring the arteries of the testicle, of the lymphatic vessel, and also it allows us to see everything and occlude it immediately. Please don't forget to give a like, subscribe, and share with your friends. Don't forget to take a look at some of the links I left below, and don't hesitate if you have any question, comments. Take a look at the Facebook group where you find a community that can help you with your varicocele problem. And again, thank you for your attention.